Hey, Jacob, this is Kelsey. If you can hear me, can you let me know how my audio sounds? All right, hey, Jacob, this is Kelsey, just doing a quick audio check. Can you let me know if you can hear me all right?
Sound good?
Hey, Dr. Greg, if you can hear me, can you do a quick audio and video check for us?
Okay, I'm here.
Gotcha. Thank you very much.
Thank you.
Hi, Miss Roma. If you can hear me, can you do a quick audio check for us? Hi, Miss Roma. If you can hear me, can you do a quick audio check?
Yes, can you hear me?
I can, thank you.
Thank you. Dr. O'Brien, if you can hear me, can you do a quick audio and video check?
Yes, ma'am. How do you read me?
Loud and clear. Thank you very much.
Thank you.
Hi, Mr. Sanders. When you get ready, if you can do a quick audio and video check for me.
All right, video's on. Can you hear me?
Gotcha. Thank you very much. Hi, Dr. Hurt. I can see you. If we can do a quick audio check.
Hi there. Happy
Yep.
beautiful day.
It is. And Dr. Gocher, I see you as well. Can you give us a quick audio check?
I sure can. Hello, everybody.
Thank you very much.
So before we start, just so I know, who are the folks that we're going to be working with as far as roll call and as far as vote call? Is it the one and the same or?
So Anderson Little will be doing a roll call for you tonight.
Okay.
Garrity Menifee will be handling the voting.
Okay. Thank you.
You're welcome. And hi, Ms. Wagner. I can see you. Can you do a quick audio check for us?
Good afternoon.
Hello, thank you. And Dr. Souza, I believe I just admitted you as well. Can you do a quick audio and video check?
My computer's struggling today.
We got you. Thank you. Hi, Mayor Jacobs. I can see you. Can you give us a quick audio check?
Hello,
We got you. Thank you.
thank you.
Hi, Dr. Shamia. We can see you. Can you do a quick audio check for us?
Can you guys hear me? I was having some technical issues today.
Yep, we got you. Thank you.
So good afternoon, everybody. And my watch says it is exactly 5 o'clock. So we would like to have a call to order of the February 24, 21 meeting of the Knox County Board of Health. And the first order of business will be a roll call. And so, Ms. Little, if you will help us with that roll call, please.
Absolutely. Good evening, everybody. Let's begin with Dr. Drake, Dr. Gocher,
Here.
Dr. Hurt,
Here.
Mayor Jacobs,
Here,
Dr. O'Brien,
Here.
Dr. Shamia,
Dr. Shamia is rebooting his computer.
okay, but I did see him come online, so,
He was on a few minutes ago.
okay, yes, I saw that. Dr. Souza,
Here.
Ms. Wagner,
Present.
Dr. Buchanan,
Present.
and Ms. Roma.
Here.
Thank you, everyone. We have all but one in attendance. Thanks.
So we have established a quorum, and the next item on the agenda is the approval of minutes from our meeting on February 10, 2021. Those have been distributed electronically to you. And at the outset, are there any additions, gross additions or corrections? If not, I'll accept a motion and a second for approval, and then we can discuss them further if necessary.
So moved.
Motion, second.
Second.
We have a motion and a second. Any further discussion on approval of the minutes from February 10, 2021? Hearing none, I sense we're ready to vote. So for voting, Charity, if you will conduct us through that, please.
Yes, sir. So voting on the minutes, Dr. Gocher,
Yes.
Dr. Hurt,
Yes.
and I forgot to say I'm Charity Menifee from Knox County Health Department. Sorry about that. Mayor Jacobs,
Yes.
Dr. O'Brien,
Yes.
Ms. Roma,
Yes.
Dr. Shamia, is he back in yet?
No.
Nope, we'll come back. Dr. Souza,
I'm going to abstain. I was not in the meeting 2 weeks ago.
okay. Ms. Wagner,
Yes.
Dr. Buchanan.
Yes.
Do we have Shamia?
No.
So right now we've passed with a vote of 7 yes.
Miss Roma needs to vote.
I thought Ms. Roma voted. I got it.
I apologize.
No problem. And I think there's Dr. Shamia. Dr. Shamia, we're voting on the minutes. They were made a motion to vote on them with no changes. Do you have your vote? I think we might still be having.
I don't know if he's receiving us.
All right. Do we want to revisit that? I think it's passed at this point with a vote of 7 with 1 abstaining and 1 we're waiting to hear back from. We'll get it finalized.
So we have approved the minutes from February 10, 2021. The next item on our agenda is to set the agenda. And again, the agenda has been.
Guys, I'm going to switch to another device. I apologize. I can't hear a word, anything anybody's saying. Can you hear me?
Yes.
We can hear
Okay,
you now,
sorry.
Dr.
I'll be back.
Can you hear us okay?
No, he can't. He cannot hear us.
Okay. Have a one-way discussion. So again, we have the agenda that has been circulated electronically. At the outset, are there any questions or opening discussions on that? And if there are none, we'll accept a motion and a second for approval of that and then be able to discuss it further if needed.
I'll motion to approve.
We have a motion.
Second.
We have a motion and a second. Any discussion on the agenda this evening? Dr. Buchanan.
Dr. Butcher, I'd like to add an agenda item for Mr. Sanders to explain how, if at all, the governor's if the declared state of emergency ends, how would that impact the Board of Health?
Dr. Buchanan, are you wanting that under other business or as a separate agenda item?
Well, can we just add it as a separate agenda item, please?
Okay, so we'll put that as item number 11 as a proposal. And we can accept that as a friendly amendment if those who have voted for approval and second will agree to that. So Dr. Souza, I'm seeing a yes. And Ms. Wagner, I'm seeing a yes and a big thumbs up. So we have a friendly amendment on that as 11, which will be a discussion with Mr. Sanders about the governor's setting of an emergency agenda. Any discussion on that at all? If not, we'll include that. And then we can get back to any other discussion on the setting of the agenda as amended. Any further additions, deletions, or corrections? If not, I sense we're ready to vote. And Ms. Menifee, if you will conduct the voting for us, roll call voting on the agenda, please.
Yes, sir. This is Charity Menifee with the Health Department. Dr. Gocher, voting on the agenda. Dr. Gocher?
Yes.
Dr. Hurt?
Yes.
Mayor Jacobs?
Yes.
Dr. O'Brien?
Yes.
Ms. Roma,
Yes.
Dr. Shamia,
Yes.
Dr. Souza,
Yes.
Ms. Wagner,
Yes.
Dr. Buchanan.
Yes.
That passes unanimously with those present.
Thank you very much. So we have set the agenda for this evening, and the next item on the agenda is Knox County Health Department's benchmark presentation by Dr. Buchanan. So Dr. Buchanan, if you have your presentation ready, we're ready to hear it.
I am ready to go. Thank you. First, I'll begin with the vaccination update. We are currently vaccinating those who fall in the first 3 priority groups, such as healthcare workers, childcare staff, and K through 12 teachers and staff, and those who are 65 and older. A full list of the eligible groups can be found on our vaccination information webpage. As we've stated before, the expanded eligibility groups this week, we have thousands of more people who can now receive the vaccine. However, eligibility doesn't mean access. The demand for this vaccine continues to greatly outpace the supply. So we continue to ask everyone to please be patient. As vaccine numbers, vaccine availability will increase over time, but it is taking time for that to happen. For an updated look at vaccine numbers across the county, you can check out our vaccine information page. We'll be updating the data every Tuesday and Friday on this page. You can see that nearly 85,000 vaccinations have been given in Knox County. Here at KCHD, we've administered more than 17,600 vaccines. And those are folks who've had at least 1 dose of vaccine. No, yes. Right, correct?
Yes.
Okay, yeah, at least 1 dose. Per the state data, which was updated yesterday, Knox County leads the big 4 metro counties in percent of population vaccinated with at least 1 dose. We know there's a long way to go, but we are encouraged by our progress, the progress our community is making. It's a testament to the great partnerships within the larger public health system in our county. And we're grateful for those partners in the healthcare systems and other providers who are vaccinating Knox Countyans. And now we'll move to the local COVID-19 situation. We have 55 new cases since yesterday's report. We currently have 1,367 active cases. 54 Knox County residents are currently hospitalized. And sadly, we have 2 additional deaths to report today, raising our total to 530. Now we'll look at the benchmarks. So the first benchmark, sustained reduction or stability in new cases for 14 days. Over this time frame, we saw daily new cases drop to approximately 91 cases per day, down from the previous reporting period, which was around 120. The average number of cases over the past 7 days was 67. This is a lower average than we have seen in several months. We've continued to see this number fall over the past month, which is extremely encouraging and something we hope we see continue. However, we want to stress that COVID-19 is still very present in our community, and everyone must continue to participate in the 5 core actions to ensure that our case count doesn't see another upward climb. Because of all these factors, we are rating representing this benchmark as a cautious green. Second benchmark, community-wide sustained or increased diagnostic testing with consistent or decreased test result turnaround time. Regarding testing, we continue to see this figure trend down. As we've continued to say, we are hopeful that this is an indication of a lower burden of disease in our community, but we will continue to keep a close eye on it. We continue to urge everyone who has symptoms or has been exposed to COVID-19 to get tested. Regarding lab turnaround time, this number continues to be consistent at less than 1.5 days for the community. Because of the lower testing numbers, coupled with a shorter turnaround time, we continue to represent this benchmark as yellow. Third benchmark, sustained or increased public health capability. As we mentioned previously, we have changed this benchmark to better reflect our capacity. As the bulk of the response activities have shifted from case investigations to contact tracing to vaccine distribution, this benchmark needed to reflect that change. The goal is to increase vaccine distribution across the county. For this benchmark, we were looking for the full public health system, or looking at the full public health system, not just Knox County Health Department, but also community health partners and others. The graph on this benchmark will be used to show trends related to vaccine administration by provider. We are working to build standard deviations into this data so we can more specifically talk about the trends. However, as you can see from the graph, vaccine distribution continues to trend in the right direction across our community. We did experience a slight dip in vaccine distribution over the past week, but not all vaccine efforts have been documented yet during this, from this time period. This week, we're representing the benchmark as yellow. We are heading in the right direction, but we recognize that the demand for this vaccine continues to drastically outpace the supply.
I got it.
Okay. Fourth benchmark. Healthcare system capabilities remain within current and forecasted surge capacity. During this time period, we've continued to see hospitalization numbers decrease. This is encouraging and something we hope to see continue. After speaking with our hospital partners, they have recommended that this benchmark be represented as green. Fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. During this time period, we have seen 27 deaths associated with COVID-19, which is down from 32 last week. Since the beginning of the year, there have been an average of 4 deaths per day, but an average of 1.9 deaths a day over the past 14 days. This is trending in the right direction, but we need to see it continue. The information available leads us to represent this benchmark as yellow. Under our supplemental data section, the first chart shows new daily COVID cases per 100,000. As of today, our 14-day trend line shows 17 new cases per 100,000, and our 7-day trend line shows 14 new cases per 100,000, which is down from previous weeks. The second chart shows the percent positive for COVID-19. This data is received from the Tennessee Department of Health. The 7-day average for percent positive in Knox County is 13.57, which is slightly down from last week. And as a reminder, both of those trend lines are above our set escalation or de-escalation boundaries. Are there any questions?
Dr. Buchanan, I have a couple questions, please, about the vaccine distribution. Do you know roughly how many vaccines doses have arrived in Knox County over the past several weeks?
I do. So if I could do some math in my head, I could tell.
It looks like it's about a little over 12,000 per week. If
no,
okay.
No, sir,
okay.
sorry.
That's okay. That's I was just pulling that off of the sustained or increased public health capacity of vaccine distribution.
Yeah. So what we're getting in,
I didn't think it was that high.
Yeah. So what we're getting in, and this is just what we know about. So there's still long-term care vaccination going on, mostly in assisted livings. They're almost done with those. So that's still happening, and I don't get any accounting of that vaccine. Right. And then some other, like I believe,
Kroger's online this week.
Kroger announced that they'll be coming online. I won't be aware of what they're getting either.
And Walmart.
And Walmart, whatever Walmart's getting. So what we're being allotted as a county that's coming through my department is it's around 5,000 to 7,000 doses a week. So it's slowly going up, which is great. But we're dividing that among our hospital partners, us, some pharmacies that have been activated, not Walmart, not Kroger, and then some private providers who are doing large clinics. So we continue to spread that throughout the community, and we continue to see that go up, which is very encouraging. But we're anywhere to, actually we popped up to about 8,000 doses just this week, and those doses will get here next week. So it is going up slowly. And so the good news is it's going up. It's going up more slowly than we'd like. And the folks who are asking for vaccine, most of them are not getting what they asked for, but everybody understands that and they're happy to have doses because they have people who want those doses and they're giving them. Everybody's staying within phase. So they're all vaccinating 65 and older, or 1A, 1B, 1A1, 1A2, and 1B. Alphabet soup and letter soup. So I'm really happy with that. I'm very happy with the fact that we're spreading vaccine throughout the county. I'm encouraged. My staff is really looking forward to being at the food city location and having some continuity for where we're going to be vaccinating and kind of getting into a rhythm, not having to move around so much. So I think we're headed in the right direction. We've got great partnerships with our hospital groups and Summit Medical and even UT, the campus. UT is helping vaccinate folks. So it's encouraging.
Where are you, and my apologies, where are you getting the numbers on the COVID-19 vaccine distribution by provider on that graph, which is showing total vaccines is much higher than that? And I thought your number was, I know that's what, as you've told us, we're getting, on a good week, we get 8,000, but it's been less than that. Where is that including other sources from the state that we don't know? Like I said, it's got like last week, this is 12,382. And I know we didn't get that through the health department anyway.
Yes, sir. Mayor Jacobs. I have to say who I am again. This is Charity at the health department. Sorry. There's a lot of factors that roll into that. You are absolutely correct. So one of them is that the data that we're pulling is from the Tennessee Immunization Registry System.
Okay.
So we are pulling every Knox County resident that's been vaccinated. So they could have been vaccinated in a different county.
Okay.
So that's part of it. And we do have a lot of folks that are still doing that. And so that's part of it. And then again, part of it's some of the stuff that Dr. B just talked about with the other facilities that are vaccinating that aren't being included in our county allocation numbers. And then the last bit of that is some folks, you're usually ordering vaccine a week, getting vaccine a week, and then giving it out the next week. And so there's some rollover there, and then with the first doses and second doses, that all plays into those counts. So it's there's a lot of factors, but that whole number you're seeing is what we can pull out of the system of folks that were Knox County residents with a Knox County address that was vaccinated in that time frame.
Gotcha. Okay, thank you.
And an important piece of that is that if you think about it, each of those 5,000 doses is matched by 5,000 more second doses in 3 to 4 weeks.
Right. Just two more questions, please. For context, how many folks in Knox County are 65 or older?
It's about 90,000.
Yes.
Right. So we're getting in the neighborhood, as you said, of 8,000 vaccines a week, which actually we cut in half because first dose, second dose. So I just hope people understand when we talk about supply and demand, that's the issue, is the supply is here and the demand is just naturally, organically going to be much higher than that. And go ahead. I'm sorry, Dr. B.
Just to clarify, those 8,000 doses are all first doses.
Okay.
They'll be matched later by second doses.
Okay.
Which is why sometimes the number's higher, because we're giving both first and second doses.
Gotcha. But still, it's a number of weeks before we're going to be able to get through that phase, number of months, actually. And just one last question. Can you please talk about the Food City location and what you guys are doing there? I don't know if we've talked about that at a board meeting or not.
I'm happy to do that. So our team was tasked with finding a place that we could be for a long period of time, predictably, to do high throughput clinics. And also, if we wanted to do smaller clinics, we could do those there as well. Basically, a home where we could put a lot of people through there and not have to move and not have to schedule around somebody else's schedule. The Expo Center is a great site, but they had events. So we would have to move all our stuff off the floor and move it back. So we kind of wanted a home. And our health department really doesn't accommodate that. We looked at lots of other places. We looked at lots of different city and county buildings, We worked with county procurement to find the right spot. And so what we were looking for was a place that was easy to get in and out of. So nice and flat, ADA compliant, have lots of parking, and would allow for the flow that we want, so people can go in one door and out another door. And also something that's relatively centrally located and close to the bus line. And this Food City property met that. We will be doing high throughput clinics there. I'm not sure exactly how many of those we'll be doing a week, but we'll also be able to do smaller events there as well for those folks who maybe just can't really manage to go to a high throughput clinic. We call those our slow clinics, and it's for folks who need a little extra help with maybe filling out some paperwork or navigating the line or something like that. So we're not pushing them through as fast, but we're getting them vaccinated. And so we're really encouraged by that. And my staff is looking forward to kind of having their own space that they don't have to worry about other people coming in and out of.
Thank you.
Thanks for that report, Dr. Buchanan. Are there any other questions regarding that report? If not, I have one question, and I'm sure we'll know more about this as time goes on, but it's been reported that Johnson & Johnson's single-dose vaccine is going to get emergency use authorization either tomorrow or on Friday, and hopefully we'll be ready to start shipping out early next week. Dr. Buchanan, have you gotten any information on that, or do you have any feeling for how many additional of those single doses that we're going to be getting at the health department or in Knox County?
I don't. What I do know is the state is still pondering their plan for those doses. Where's the best use for those doses? And my understanding is also that, like the other vaccines, Johnson & Johnson will not be a wave of a bunch of doses. It will continue to trickle.
Thank you.
The other thing is important to remember that the Johnson & Johnson vaccine has really good efficacy in reducing hospitalizations and complications and death from COVID. It is a very effective vaccine, much more effective than what we all take in seasonal flu vaccine, honestly.
Any other questions on our Board of Health or Knox County Health Department report for this week? One quick comment. I've got a kind of a running scorecard of all of our benchmarks dating back to late August. And this is the first time our benchmark one has been green since 9/30/2020, and before that, 8/26/2020. And the first time benchmark 4 has been green since we've been looking at it. So congratulations to everyone for hard work. We're obviously making progress. If there are no other comments, we'll move on to the next presentation, which is University of Tennessee Medical Center Knoxville data update by Dr. Shamia. And Dr. Shamia, if you are ready, we will hear your report.
Thank you. And I apologize for some technical issues I had at the beginning of the meeting. I do just, if I could get a nod that you guys can hear me, okay?
Yes.
Okay, very good. And so I do think this will be fairly brief tonight. Next slide, please. Did the slide advance? Okay, thank you. I thought that was my computer. And we see the week by week cases in the county and the district. I think the things to see here is it's leveled off. If you see over the last 4 weeks in Knox County, we've had a steady number of new cases. I still think it's important that we put that in context. On one hand, it's great to see it have leveled off. And when you look at where we were It's still a significant number of cases per week. Now, as more of the more vulnerable population is vaccinated, the correlation between new cases and hospitalizations may change over time. Next slide, please. So across the state, a little bit of discrepancy. You see us on the far right. We're probably the most stable, whether, one way or the other. Shelby has most recent week dropped. Davidson is kind of up and down. And then Hamilton has seen a nice drop, and they seem to be leveling off. Next slide, please. So this finding is true across all of the age demographics. So I don't think that needs to be elaborated on more than that. Next slide. The positivity rate, our version is calculated slightly differently than what Dr. Buchanan showed, but it is actually very close this week. It's in that 14% range. Still trying to get that below 10 and then 5%. But you saw we'd seen a spike in the prior week, and that's come back down. And some of this is also related to how smooth or not smooth the data is in terms of when it's available. Next slide, please. So new hospitalizations, that we've said always, this one is the most data lag of anything, but you see new hospitalizations in the county for at least how they're being counted is stable, with more of a drop in the district. Next slide, please. This is the one that is most notable in that the inpatient hospital census across the district just continues to drop. And on our daily capacity call, which is now actually not daily, it's Monday, Wednesday, Friday at this point, hospitals are full, but it's just getting back to what were prior volumes and the prior distribution of illnesses we would see. We still certainly have COVID-19 inpatients, but clearly we don't have as many. I think it's also notable, and we've mentioned this before, we've seen, for all intents and purposes, no influenza in the hospital. It's been quite remarkable. Next slide, please. And so these are the projections, and I don't think any of us truly expect us to be down to zero in those weeks ahead. But it has, without question, been impressive at the consistent drop in inpatient hospitalizations and the inpatient census, and that's what really led to that benchmark change. And I believe that's my final slide. So Dr. Goetsch, I'll be happy to field any questions.
Thank you, Dr. Shamiya. Are there any questions or comments on Dr. Shamiya's report? If not, again, thank you for that report and the ongoing steady good news that we're getting. It's very encouraging. So if there are no other comments, the next item on our agenda is the educational institution reports. And I believe Dr. Gregg is on the line with us this evening from the University of Tennessee. So Dr. Gregg, if you have any additional information, we have a report, of course, that's been previously submitted by the University of Tennessee.
Nothing really here to add. I appreciate you all having us back again tonight. We're pleased with where our numbers are at the university. Our positivity rate through our mandatory pooled saliva testing for on-campus residents remains less than 1%. The testing that we're seeing through the Student Health Center pretty much reflects what you're seeing in the greater Knoxville community of around a 13 to 16% positivity rate. We have had a slight increase in recent self-isolations, but that's actually a positive thing for us because it's a reflection that our pooled saliva testing is still identifying those that are asymptomatic and positive, and so that jump in self-isolations has really been from quarantines of their close contacts. So again, we're pleased to participate in the vaccine process as well, and have a large public event planned for Friday, and our continuing small daily events through the Student Health Center.
Thank you, Dr. Gregg. Any comments, questions to Dr. Gregg about the University of Tennessee's report this evening? If not, thank you, Dr. Gregg and University of Tennessee for the report and for your continuing hard work. Thank you very much. Next, under educational institutions, are our Knox County schools, and we have a report. And Ms. Wagner with us this evening. Do you have any additional information or just comments on that report?
Our numbers have decreased some. We were less than 100 cases this week, so we were happy about that. And also, we started our immunization, the vaccine rollout with Children's Hospital. So we're very happy and with the partnership with Children's Hospital. So we're very excited about that.
That's great news as well.
Yes, it is.
Any questions or comments on Knox County Schools report for this meeting?
Dr. Goetzer, I'd just like to thank Knox County Schools. I think it is important that our young people be in person at school as much as possible. And just like everyone else, of course, COVID-19 has had it's been a very heavy lift for schools. And I think they've done a remarkable job all the way around. So I just want to thank them for everything that they've done throughout the pandemic. It's been, like I said, it's been truly remarkable.
Thank you, Mayor, for those comments. And thanks to Knox County School for their hard work in this as well. Any other comments on our educational institutions by any of the board members this evening? If not, thank you all for that. And the next item on our agenda is discussion of the meeting schedule if in-person meetings resume.
So we have been advised that the governor is going to extend the virtual meeting option, but we don't actually have that in writing yet. I haven't seen that executive order come out. I don't know, Mayor Jacobs or Mr. Sanders, if either of you have seen that. So without that order, I do think we need a plan because we'll need to know what we're doing going forward. So you all received the schedule of reservations that we have in the large assembly room. Those are pretty fixed because of other meetings that they they host in that room. So if we were to go back to having to meet in person, one suggestion I have is to consider shifting to monthly meetings, even if we stay virtual. And if we did that with the in-person meeting, what we'd end up having to do is meet in 3 weeks instead of 4 weeks, and then go to a monthly schedule after that. Because the every other week schedule has this meeting again next week. I guess we'd meet in 2 weeks. Sorry, we'd meet in 2 weeks still, but then go to monthly after that. Or we could just go to monthly after this meeting. I'm wondering if we need to continue to meet every other week. We have these reservations. If we were to have to go to in-person meetings, we could shift back to every other week if we needed to. But I believe we need to, no matter what we decide to do this evening, I think we need to get on this schedule so that we can then transition to a meeting space that's physically available when we eventually cannot meet in person, meet virtually anymore. Sorry. So first, I guess, what are people's thoughts about meeting monthly instead of every other week at this point in the pandemic?
Comments on that agenda item from board members?
I think I would be comfortable meeting monthly if we had I would just want in some way, whether it's virtual or whether the rule is that we're in person, have the ability to adjust back to every 2 weeks. And if that means that we then have to change venues, just that we can manage around that. But based on where we are right now, and I've got no indication that it's going to, dramatically change in at least the next few weeks, even with the variants and whatnot, I'd be okay with it.
Other comments from board members?
I think I'd also be fine going to once a month, as Dr. Shamiya said, as long as we've got the option to add a second one in the middle. I guess one question I do have, though, is if we do end up having to go in person, Mr. Sanders, I don't know if you could check if there's provisions for people that have not either been vaccinated or had COVID to still Zoom in if we don't want to come to an in-person meeting with public forum.
I can check. I'm not aware of any offhand. If the executive order that permits the virtual meetings expires, as far as I know, you're stuck going to in-person meetings. But on the other hand, as you may know, the main assembly room at the city county building has partitions set up for people seated up on the dais, and you're a substantial distance away from the general public there. But I can check and see if there are any special provisions, but I wouldn't know offhand. I'm not aware of any.
Okay, thanks. Yeah, I guess I've just seen some of the county commission meetings that there can be a lot of people in there.
Right, they do.
Right, and the seating is really set up down in the main level to space people out in the audience. And then if you remember the one meeting we had in that room, we went in and moved seats and spaced people out. I would not suggest that we sit as close as county commissioners sit, even with the partition. We would have to space ourselves out better than that.
Any other comments?
Dr.
Ahead.
Gocher, one other thought is simply the time, and I bring that up simply because when we're virtual, I mean, it's not uncommon that I may have finished literally 60 seconds before the meeting starts and hopped on Zoom. And so, I don't know how many of us that affects, Dr. Gocher, with your clinical schedule, but I'm not saying I couldn't make it work, but it's something that I would just need to kind of plan around, and it could end up being a difficulty.
I'm still in scrubs today, so I just finished working. So it's easier for us to do Zoom, but we understand when that order expires that in-person meetings are probably warranted or would be. One point that I would have for being able to sort of circle back to shorter meetings is this: we're seeing the positivity rate falling, and we know we have some preset at least inflection points where we're going to look at relaxation of some of our restrictions. And I would like to not have the meetings spaced so far apart that if we ended up with a low positivity rate and we all agreed that sanctions could be lifted or altered, that we would be, weeks away from being able to do that. So we would need to, hopefully watch those positivity rates and be able to meet either virtually or in person if we need to, depending on what we're allowed to do.
So yeah, Dr. Gocher, that would be your prerogative as chair to be able to call a called meeting.
Okay. Any other comments on that?
Should we consider setting a time if we have an in-person meeting of 6 p.m. just because of or 5:30? Would that be better for getting cleared and getting over to the city county building?
I think, first of all, if it's virtual, if we extend it as virtual, it can stay just like it is as far as the time. 5:30 makes a big difference. I don't know if it would have to be 6, but 5:30 is helpful.
5:30 would work with me. We could, alter schedules.
And do we need a motion, do you think, or are we just having just general discussion about this so we have a plan?
Dr. O'Brien, my sense is that this is a general discussion because this is really all going to be based on the executive order coming out of the governor's office, which, traditionally he waits until the end of the month to do that. So it's coming up, but, we haven't heard it yet. And Dr. Buchanan, your thoughts or Mr. Sanders, your thoughts are that he is going to extend it one more month?
I don't have any information either way.
Okay.
I have been advised by somebody who gets the information from the governor's office, but again, generally that doesn't happen until right before it expires. So I guess in my mind, there are a couple of things here. One is in anticipation of eventually moving to in-person meetings, we do need to shift when we meet. Because even if meeting monthly, every other, we're off schedule, we're off cycle with when that room is available. So that's one thing. The other thing, so we need to shift that. Then we wouldn't have to do it when we do actually go back to in person. The other question before us, I think, is it time for us to shift back to monthly meetings? And then that would get us on that schedule. Our next meeting would be on March 31st, which would be approximately a month from now. So I would go ahead and put that forward as a motion that we change our meetings to monthly. The next meeting being 3/31/2021. That would be our first meeting in the month of March. It would also be public forum. And I would go ahead and just say that, if we're still virtual, we'll keep our meetings at 5 p.m. And then we can make that decision about 5:30 when we have to shift back to face-to-face.
If I may, I think you probably need to put this in the form of a motion. I was just reviewing your rules, and the rules clearly call for meetings to begin at 5. Now, they do also call for the board, or allow the board to set meeting times at other times, but I think that calls for a vote of the board. So you probably need to put this in the form of a motion and then vote on it to make sure that you're in compliance with your own rules.
So, Mr. Sanders, I take it we really are looking at two motions. One would be monthly meetings and one would be the time of the monthly meeting. Is that correct?
If you want to do it that way, I think you could combine them into one motion, and you could even make the motion, form the motion in a way where the timing is contingent on an executive order that makes the meeting virtual or not, but it's entirely up to the moving party.
Let me rephrase my motion. I make a motion that we move to monthly meetings, and if we're meeting in person, we start our meetings at 5:30. Otherwise, meetings will start at 5 as they happen.
We have a motion. We have a second.
Second.
Dr. O'Brien, motion and a second. Discussion on the motion, please. Any thoughts, discussion?
So just to clarify, the first one would be 3 weeks away from tonight, though, correct? So that we can be on schedule with the room reservation. Is that right?
It'd be 5 weeks.
Yeah.
So either 3 or 5, depending on.
We could do 3 or 5.
Okay.
I don't know. I mean, whatever the board wants to do would be fine.
Is that 3:17?
3:17 or 3:31.
Dr. Buchanan, your original motion was for 3:31, or were you specific about it? Do you recall?
I would entertain that as a friendly amendment. I'm fine with 3:17, and then moving to monthly after that. So we could move to monthly meetings. Just skip our next meeting and have our first monthly meeting on 3/17/2021. St. Patrick's Day.
Oh boy. So we have a kind of a slightly amended motion, and Dr. O'Brien, if you're okay with that amendment or that slight change.
I'm okay, but disheartened. I would rather with my name.
Oh yeah, I understand.
Not going to be anywhere, but still.
Gosh, with a name like O'Brien, come on. So we have a motion and a second. Any other discussion? If not, are we ready to vote?
Just a quick question, and this is like, I agree. I think this is a good idea. So Dr. Buchanan, what they're proposing is not necessarily to extend the state of emergency for the state, but simply to just potentially allow virtual meetings, correct?
I honestly don't have any more information than the possibility of extending the virtual meetings. I would assume it's hand in hand, but that's just my assumption.
Okay, yeah, because I guess just going back to the, if we're no longer in a state of emergency, if I'm correct, the board cannot actually make regulations. Is that true?
Mr. Sanders is going to talk about that shortly.
Okay, then I can wait.
Very good. Any other discussion on the motion before us for changing to monthly meetings, the next one being March the 17th, either in person or virtual, depending? Discussion? Hearing none, I sense we're ready to vote. And so, Ms. Menifee, if you'll go through a voting roll call with us, please.
Yes, this is to Charity Menifee with the Health Department to vote on the new meeting schedule. Dr. Gocher,
I approve.
Dr. Hurt,
Yes.
Mayor Jacobs,
Yes.
Dr. O'Brien,
Yes.
Ms. Roma,
Yes.
Dr. Shamia,
Yes.
Dr. Souza,
Yes.
Ms. Wagner,
Yes.
Dr. Buchanan.
Yes.
Passes unanimously with those present.
Thank you. We have changed the schedule on those meetings. Our next meeting being March the 17th. Appreciate it. Next up is agenda item 10, which is review of and discussion of regulations. And the first one to be discussed is 2020-1, which is the face covering regulation put into play on July 1, 2020. Any discussion on our face covering regulation? Any comments about issues, problems? Any discussion on that one?
I would like just to bring up one thing that the public has brought up to us, and they keep saying a certain part of the public wanting us to stop the mask regulation. At this point, our positivity rate has not met our goal to do so. So I just want to remind everybody, we're still at a point where we have COVID in the community, and the most prudent thing is to continue as is. And we want to drive that number down, but if we let off on the gas on this one at this point on that specific one, I think that would be counterproductive. I just wanted to state that.
Right, and I would say from the public health perspective, mask wearing would be one of our last things to recommend going away. Just like hand washing and staying home if you're sick, mask wearing is now part of our vernacular for preventing COVID.
Any other points of discussion on 2020-1? This.
Oh, and also mask wearing continues to be, or is currently a federal recommendation.
As a matter of fact, aren't they recommending double masking now?
They're recommending that your mask fit tightly, snugly, and if your mask does not fit snugly, consider double masking, or if you are in a situation where your risk is higher, consider double masking. Dr. Drake, can you please identify yourself since we cannot see you?
Dr. Drake, are you online with us?
I am.
Okay.
This is Diana Drake. I was using the wrong Zoom meeting, I think, number or something, the one that somebody else had sent. So anyway, I think I'll make a motion that we continue the mask mandate.
Recall that this one does not have an expiration date, so.
Oh, okay.
So I don't think we would need a motion on that, but we've typically just had a period of general discussion about it, problems, any thing that we need to discuss as a board.
Dr. Drake, if you can, please turn on your video.
Okay. Now.
There we go.
See you now, thank you.
Okay, any other
Dr.
2020-1 for this evening?
So, Dr. Gocher, one additional thing, and this is something that our hospital epidemiologist taught me, and so I think it would just be worthwhile mentioning, and Dr. Buchanan, you can chime in as to whether you're on board with this conceptually, but when you start hearing about, herd immunity and whether we have achieved any herd immunity, some herd immunity, what he explained to me was the threshold of either vaccination or prior infection that's required is lower when you still got mitigation measures in place. So if you're still wearing masks, it takes a lower percentage to effectively achieve some functional herd immunity than if you don't have masks. That's the same for social distancing. That's the same for all these things. And so part of the fact that we're having some success right now is likely the intersection with the we're starting to get people vaccinated, particularly higher risk people. A decent number of people have had COVID and have some at least immunity if they've had it within the last 90 days, maybe longer. And then also the fact that we're still doing these mitigation measures. And so, that was kind of eye-opening to me when he explained that. Dr. B, you buy that? Is that?
Yes, totally.
Okay.
Yes, absolutely. Mitigation plus some immunity is helping us out.
And I guess to review, we had, and Dr. Shami help us out with this because I think this was the topic maybe a month or so ago that you had brought up, and that is, when do we have positivity rates that are going to cause an inflection point so that we would look at altering any of these regulations? And I believe we looked at both 10 and 5, and could, if you could you review that with us?
Well, what I recall, and I don't have it in front of me right this second, and again, Dr. Buchanan and Charity can help me, but it was, we were at a different threshold for when we were adding measures or regulations than when we're necessarily taking things away. And so I think for us, 5% positivity was a number we were trying to get to. But I will also remind everybody that those were not absolutely rigid when we talked about those. Those were, I believe, intended to be a guide for us based on, those are pieces of information in a broader context. But to me, to feel really, really good about this, we're below 5%. So Dr. Buchanan, do you have a thought?
No, I agree with that. I think the other piece that we'll be considering are the benchmarks that we present every meeting. And as those tend to trend down, I think, again, mask wearing is one tool in our toolbox right now that we know works, that people can do, that reduces disease. Vaccines come on board, and that's part of it as well. But, in order to stay on top of this, we've got to continue wearing masks, and we're going to have to continue wearing masks for a while longer. And I know people want them to go away. I get it. But people don't want cases to go back up, so you can't have both. So if we want cases to continue to go down, the masks need to stay.
Any other comments on 2020-1 this evening from the board? If not, we'll move to item B under 10, which is restaurant occupancy limitation and early closure, which has an expiration date of March the 4th. So this is something that we may need to act on if there's a decision to extend it. So discussion on 2021-1.
I make a motion that we extend this to March 18th at 12:01 a.m.
We have a motion. Is there a second?
I second it.
We have a motion and a second. Discussion.
I'd like to just bring up so we can talk about this, knowing what's going on around the state. I just looked at Shelby County and Davidson County, and they have amended in the last week their restaurant and other closures to midnight based on the numbers that they've had in their communities. And I think it's time that we need to just talk about it. and see, are we at a point where we might do that and not hinder our business as much as we have to some extent, but we have to balance it with what the pandemic requires. Our numbers are good. We don't want them to go bad. But I'm wondering if we're at a point where we could also help the business community and consider at least a midnight time at this point and see what everybody else thinks.
Dr. O'Brien, would you like to make that in the form of a motion for further discussion or general discussion?
Okay, I will. I'll make a motion that we amend the time of the curfew from 11 p.m. to 12 a.m.
So we have a motion. Is there a second to that motion?
I'll
We already
second.
have a motion on the table to extend it. You can't, you'd have to, Mr. Sanders, help me out here.
Yeah, I believe as we established, I was actually just trying to find this in the old language of the old rule, but I believe as we established in the last time that you changed the language of one of your regulations, what you're really doing is allowing this one to lapse and establishing a new regulation with a new time on it at this point. It's the housekeeping detail, but probably an important one from the point of view of the board.
You're exactly right. That's how we did it last time, if everyone recalls. So Dr. O'Brien, if you're in agreement, if you would make a motion to that effect for either an immediate or a timed lapse of 2021-1 and then I guess a reinsertion or a modification, which would be probably 2021-2, I'm thinking, for the amended hours. But
I will make that as my motion that we establish a 2021-2 that takes what is in the current public health regulation and leave the other portions with the exception of the time, with that time changing from 11 p.m. to 12 a.m. and have that start tomorrow night and proceed until March 18th.
So we have a motion. Is there a second?
I'll second that, but does that have to be a substitute motion, Mr. Sanders? We never voted on it.
It was the first motion seconded or not?
Yes.
Yeah.
Yeah, it probably has to be a substitute motion then. I didn't hear the second, but.
Sorry. Yeah, the seconds came in a flurry, Mr. Sanders, so I didn't know who seconded it. So how do we back out of that?
Could we just have some general discussion? Is that possible after the first motion and second?
Sure.
So we have a substitute motion on the table. If there's a second for the substitute motion, then we're discussing the substitute motion.
Is there a second for the substitute motion?
The mayor.
Okay. So we have a motion and a second for a substitute. I guess amended. Is it amended or is it substituted resolution?
It's a substitute motion.
Got it. Discussion, please.
So I'll start, Dr. Gocher. So I mean, we made that change, several weeks ago, and it really, I mean, we didn't continue to see cases go down, but we also didn't see cases go up. I guess the question is, it's that balancing act of, what is an hour to the pandemic versus what is an hour to the businesses, and I can't answer that second question. But we said we would take this kind of slow, and so that's the other question: is does making a change like this qualify as still kind of ratcheting back slowly?
I would hope that it would be considered slow. I mean, Hamilton County doesn't even have this in place at this point, nor have I seen, but I haven't really looked into Sullivan and Madison of this sort. So, I mean, I guess since we're number 3 in the state and the other 2 have had similar trajectories, and they made those changes last week, we are probably in I think, a little bit better position than Shelby and Davidson potentially. So that's where my thought is. And having been a business owner in this community, every hour is helpful to business. And if we can get to a point where our balancing act is such, I would like to offer that hour back to them. It's only 7 hours a week potentially, but it's 7 more hours.
Thank you, Dr. O'Brien. Further discussion?
Yeah, so I think that maybe we went back to 11 p.m. maybe 4 weeks ago, because I think I originally proposed that. And I think since that time, our hospitalizations have drastically improved. Our cases have improved. So I would be supportive of pushing it back to midnight at this point, especially with us not meeting for another 3 weeks.
Further discussion? So, Mr. Sanders, if you will kind of review for us, because we are kind of review for us exactly what this particular vote is, so that we're clear on it.
So my understanding is you're at this point voting on the substitute motion. And that's what I gathered from what Dr. Buchanan said.
Right.
Yeah, and so the substitute motion is that a new motion 2021-2, which supersedes 2021-1, with all the same language except that restaurants and bars close at midnight, and that it be extended to expire 12:01 a.m. 3/18/21. You said to start tomorrow evening, but we'll need a time on that.
Do we need time prior to voting, or is that something that we established after the vote?
I think we need a time before, don't we?
I think so.
So can we have it start at 12:01 on tonight? So it starts then, which will allow businesses to have the opportunity to be open tomorrow night if they would like.
Is that can you get it out that fast?
No. Simple answer is no. I mean, because that would require us to get it written and published and signed before 12:01 tonight, which we can do it by tomorrow night, but not by tonight.
Well, then let's do tomorrow night.
Okay,
Let's be realistic.
Reality.
So Dr. Buchanan and I have a plan, and it usually works sometime in the afternoon. And we can get it. I think Dr. Buchanan, back to you by 2 or 3 in the afternoon is what we usually do.
And Dr. Gocher,
Yes.
this motion, the regulation expires March 18th. The next Board of Health meeting is March 17th. Is that correct?
Yes, sir.
Just make sure. Okay, thank you.
And we have the ability to have call meetings if there are circumstances that warrant it.
Make sure we had another meeting before it expired. So
Right.
Yes, sir. Thank you.
Any other discussion on the substitute motion? If not, I sense we're ready to vote. Any other discussion? And Ms. Menifee, if you will conduct the voting roll call for us, please.
This is Charity Menifee from the Health Department with the roll call vote for the substitute motion to establish the new 2021-2 as described. Dr. Drake?
No.
No. Dr. Gocher?
Yes.
Dr. Hurt?
Yes.
Mayor Jacobs?
Yes.
Dr. O'Brien?
Yes.
Ms. Roma?
Yes.
Dr. Shamia?
Yes.
Dr. Souza?
Yes.
Ms. Wagner?
Yes.
Dr. Buchanan?
Yes.
It passes with a vote of 9-1.
Thank you. You have substituted 2021-1 with 2, and that will go into effect getting everything signed tomorrow evening. Next on the agenda is sub-item 3, which is COVID-19 social gathering limitation regulation, which expires March 4th, 2020-8. And we're open for general discussion on that.
I'll make a motion that we extend this to March 18th.
Second.
We have a motion and a second to extend 2020-8 to March 18th. Discussion.
Do we know if anybody's made comment on that specific regulation, or have there been concerns, or is it something that's kind of is not really in anybody's mindset right now? I haven't noticed that in looking at some of the other regulations around the state right now. So my question is it helping us? It may be helping us. I know it's not really hurting us, but do we even need to have it? That's another question. Just wanted to bring that up.
I mean, as we look over the email that we get, I think most of the ones that I have seen that have been negative have been sort of globally negative. You know, in other words, lift all regulations. And I didn't see one that zeroed in on any one, with the exception of maybe masks. So I didn't see one that zeroed in on this one particular, Dr. O'Brien, in answer to that question. Did anybody else, does everybody concur as they read their emails? It's kind of the same thing.
So the question, I guess, is, do we think it's helpful to have a regulation on the books at this point? And that's the only thing I want to bring up, versus following the Tennessee pledge, and which we already said we were going to do. So it does kind of talk to this in more general terms.
And I would just
go ahead, Dr.
sorry, that this is really built on the 5 core actions and being able to socially distance in gatherings and trying to limit gatherings of people who are not from the same household.
Further discussion on 2020-8.
I'll simply just reiterate back from the data that what we saw, this stable week to week number of cases, is still very significant. It's more than what we had in the earlier part of November, for example. And so the idea that if the R naught goes up just a little bit, that thing that says how many people get infected by a person if we start to see a variant, I think that I mean, this is still not the time to send the message that we want large gatherings, for example. And as Dr. Buchanan said, I mean, you know, you're still best when we still have a very largely unvaccinated population with members of your household following the 5 core actions very closely in small groups when you're not. So I just have always been concerned about that when this one goes, it kind of just sends the message that this is behind us. And I don't think it's, although I'm very optimistic, I feel good about, you know, everything that we showed. I just don't think it's behind us quite yet.
Dr. Shamia, is this one that you would look at a positivity rate of between 5 and 10 before you would trip the switch on it?
I'd personally like to see us below 10% on this one. You know, again, it's all, there's several pieces that go into those decisions. It's never just one number.
Right. And traditionally, we've been using our benchmarks, and they're getting better, but they're not uniform, you know, at this point. Further discussion on 2020-8. And I believe we have a motion and a second, so we're in discussion on that motion to continue it until March the 18th. Is that correct?
Yes.
So it's beyond the, okay. So any other discussion on that motion to continue? If not, since we're ready to vote, so Ms. Menifee, if you will conduct the voting roll call for us on 2020-8, please.
Yes, sir. This is Charity Menifee with the Health Department on extending 2020-8 to 3/18. Dr. Drake.
Yes.
Dr. Gocher.
Yes.
Dr. Hurt.
Yes.
Mayor Jacobs.
No.
Dr. O'Brien.
Yes.
Ms. Roma.
Yes.
Dr. Shamia,
Yes.
Dr. Souza,
Yes.
Ms. Wagner,
Yes.
and Dr. Buchanan.
Yes.
Passes 9-1.
You have passed the resolution to continue 2020-8 until March 18. The next item on the agenda was the added item regarding the emergency declaration from the governor, I guess is a general way to put it. Dr. Buchanan, would you like to lead that discussion for us?
Actually, it's just really a question from Mr. Sanders.
Okay.
The governor, or when the governor lifts the declared emergency for the state, how or if it impacts the board's ability to set policy and do what we've been doing.
Okay, this is going to be a little bit of a longish explanation, but let me sort of take it through to you. The executive orders are really what we're talking about here. The executive orders are a function of the emergency declaration. That is, the governor issues the executive orders that both declare the emergency and enact certain powers due to the state of emergency. So really what I'm going to be talking about here is the executive orders. This Board of Health right now is governed under statute. And there's a statute in place, TCA 682601, which gives the authority for the Board of Health. And essentially what it says is that in the pertinent part for you is the Board of Health may adopt rules and regulations as may be necessary. And that's regardless of the executive orders. That is, it doesn't matter whether there's an executive order or not. You have that authority under statute. Now, what the executive orders do for the Board of Health, the executive orders, what they do is they establish a ability of the county, 6 counties with what they call locally run health departments, and Knox County is identified as one of those, to issue orders and measures related to the regulation of COVID-19 that can be greater or lesser than what the state has in place. That is, you have considerable autonomy under, or the health departments do, have considerable autonomy under these executive orders that are currently in place. Most recently, Executive Order 73 from the governor, which is really an extension of Executive Order 38. And that's different from the statutory power, because the statutory power which you have says that the regulations you extend must be at least as stringent as state law. So in essence, what the executive order gives you is the ability to be less stringent than state law. Now, there's also statutory authority for the health director and health officer, both one and the same in Dr. Buchanan in Knox County. She has essentially power to quarantine, power to close businesses, but those are all constrained by statute and regulation, and usually you have to go to court in order to do that. I'm not going to mire you down in the details, just let you know she has that authority under certain circumstances. Now, again, she is given more authority, or the health department is given more authority under the executive orders. However, so long as this board remains in place, this board is the governing authority for the health department. So really that authority rests with you, the board, and not the health department itself. So, but if the executive orders are not renewed, then we're back to the same situation we were in before this whole COVID business came out. Your governor's statute, and you have the authority to adopt rules and measures as may be necessary that are at least as stringent as state law. The rub comes, however, if this board ceases to exist and if there are no executive orders in place. At that point, there is no independent authority for the health director or the health officer to make the COVID-related regulations that she has right now under the executive order. or she would have, in which case, essentially, she reverts back to being an agent of the State Commissioner of Health, enforcing State Commissioner of Health provisions. And Dr. Buchanan, you have a puzzled look on your face. Is that not?
Yeah, I'm puzzled. Yeah, so the health officer, health director in Knox County have, for the past 17 years, been appointed by the county executive, not the health officer, the health director. And you can go back and look at where Mr. Edmund Bolt was dismissed by the executive, Mr. Mark Jones was put into place by the executive, and then I was put into place by the same executive. And so that's where I'm a little confused about the Commissioner of Health piece.
Right. So it's interesting because the statutory, and I think we're probably getting a little beyond the purview of your question here. The statute actually says the director and the health officer are appointed by the State Commissioner of Health or his designee, her designee, which I suppose could be the mayor in these instances. And if it's appointed by the State Commissioner of Health, that's with the concurrence of the mayor. But that's not really pertinent to this question. The question is, what is the authority or what is the duty of the health director? And the duty of the health director, absent any other regulation or order, is to carry out the mandates of the State Commissioner of Health. It seems to me, under the statute. Now, I will acknowledge that I have been in touch with the State Attorney General's office or at least Attorney in State. I'm not sure she was with the State Attorney General's office, but this is just a badly written regulation considering current practice. I acknowledge completely that, in fact, the appointment of the health director and health officer have taken place just as you state. And I'm not trying to say that that's wrong. It's just that I think that generally your duties, absent anything else, is to carry out the directives of the State Commissioner of Health. But right now we have other provisions in place. This Board of Health exists and it governs the health department as well as the executive orders.
Mr. Sanders, can I throw a little more mud into this? This
Sure,
is not actually pertinent to, again, this is not pertinent. This is just for my own edification. And I'm going to ask you to do something which lawyers don't want to do, that speculate a little bit. Since we are one of 6 counties that has its own health department, is the confusion here the fact that this is actually written germane to the other 89 counties and has been kind of just thrown on to us as well? Well, what I'm saying is the other 89 counties are actually part of the State Department of the Health Department of the State of Tennessee. We're a little more hybrid. And is that where we're getting into the issue of, the health commissioner appoints the county public, and I'm confused too, because we have a senior director and the health, the public health official, and those are actually 2 separate positions. But is that kind of where we're getting into some confusion with the TCA, you think?
I think it is. I think that's a very reasonable assumption. The TCA makes no mention of these locally run health departments, which the governor's executive order does. And for all I know, this framework of these locally run health departments came in after they last amended the statute. And that may very well be the cause for mud. I'm not trying to get into the weeds of who Dr. Buchanan takes her orders from or who has the higher authority for her. The question I was asked is what happens if the executive order goes away, essentially. And so long as this Board of Health exists, the Board of Health's abilities to regulate continue essentially unabated, with the exception that they probably can't do anything less stringent than the state does. But if the Board of Health and executive orders go away, we're in a different situation this county hasn't been in since the 1980s, at least.
So, Mr. Sanders, in that exact situation, then who makes public health decisions for Knox County?
Good question. That's the question. I don't have a good answer for you right now. It's not been established.
Okay.
I guess to further muddy those waters, we have a legislative effort that seems to be moving along to make our board, I guess, there's more legal to it, but make it basically an advisory board. How would that affect decision making if you were to speculate on that?
Well, you know, I hate to speculate. What I will mention is I believe that piece of legislation places the authority in the county executive. I believe that's the way it's being proposed right now. So at that point, there would be a clear chain of command.
Okay.
But I don't know what's going to come out of it. I certainly wouldn't speculate on that.
Exactly. Thank you. Any other discussion on this item from the board today? It's kind of confusing and twisted, and I appreciate Dr. Buchanan and Mr. Sanders, your discussion on this. It's, I think, been helpful for us as well. So the next item, if there's no other discussion on that, is the other business. Is there any other business to come before the board this evening?
Could I just bring up something that, and this is a technical thing that came up during one of the hearings I was called to. The hearing officer looked over our minutes of one of our meetings and brought up to me during the hearing with the city of Knoxville, the beer board hearing, that one of our minutes was incorrect with a time in it. And in talking with Mr. Sanders, what I'd like to do is see if we can fix that one meeting minute time that was incorrectly noted and make a motion to amend those minutes. And I'll tell you where it is. It's the minutes of the meeting of November, let me see here, hold on a second. Of November 10th, 2020. And in that, those minutes, we had an area, it was section X, where it was noted that we were discussing the current curfew, and our curfew at that time was 11 p.m., but it got typed in as 10 p.m. And that came up in the beer board hearing, and they noted that we had incorrect minutes. And another attorney also noted that. So I would like to see if we could make a motion to amend that section X to change the time from 10 to 11, which is what it should have been, because at that time on November 10th, our curfew was 11 p.m. I know that's technical, and I don't know if we need to really do it, but it came up in legal proceedings.
Well, Dr. O'Brien, if in fact your comment is correct, I think we should. But what I would like to do, if any of the board members or Mr. Sanders has this information sort of at the tips of your fingers, is to give us what those curfew times were over time. In other words, when we started that curfew, my recollection was that it was at 10 and then it went to 11 and now it's at 12. But you're saying it was 11 and then went to 10 and then back to 11 and 12?
Yes, we started differently there. So we were at 11 when things weren't so bad, started getting worse in November. Later in November, we went down to 10 and we held at 10 until we went back up to 11. We could wait till the next meeting and put this on the agenda and actually give you that section X. This is not a rush thing, but I don't know that there's any more legal hearings coming up in the next 3 weeks that would bring this up, but it was minutia that I got asked right in the middle of the hearing. And I said, they asked me, was that the correct time? They pulled up all our minutes and said, that's a typo. And they had our regulations up right next to it, and it showed we had a different time. So let's just, I'll just hold this off, and we'll make it just an agenda item for the 17th and just put that in there so everybody sees it.
Thank you for bringing that up, Dr. O'Brien. That's a good point. Any other business to go over as a board this evening? If not, I appreciate everybody's input and thoughtfulness in the meeting this evening. And our next meeting, as you know, is going to be on the 17th of March. Sooner if there's something that warrants that, but otherwise we'll make it on the 17th. And I'll accept a quick motion and second for adjournment, and then plan on seeing everybody then, if not sooner.
Motion to adjourn.
Second.
Thanks, everybody.